Hello, everyone, and welcome to today's session. Today, we'll be discussing the NCERT exercise for the chapter Reproductive Health. This is the part 2 of the lecture. So, in the part 1, we have discussed some of the questions, and rest of the questions we will discuss in this session. Before starting this lecture, I just want to give you one information that the images, text, and other materials used in our presentations are for education purposes only. We respect the intellectual property rights of the original creators and owners. If you are the owner and have any concerns or issues, please contact us at sathee@iitk.ac.in and we shall remove the content immediately. Please note that parts of the content may have been generated using generative AI, which is experimental. So, what are the objectives of today's session? So, we will explore and we will understand the fundamental concepts of the chapter 3, which is reproductive health, by working through the NCERT exercises. So these questions are based on some concepts. We will understand this concept by discussing NCERT exercise. And I'll tell you on which concepts are these questions based. Okay, you can get the questions in the NEET exams also from these concepts. Okay, so this chapter is very important. The weightage of this chapter in the NEET exam, it is 2%. And on an average, 1 to 2 questions come from this chapter in the NEET exam. Okay, so this chapter is very important. So we'll discuss the question number 7 to question number 12, okay, of the NCERT exercise of this chapter, reproductive health. This is chapter 3 of the NCERT textbook. So let's begin with this first question. The question is, removal of gonads cannot be considered as a contraceptive option. You have to justify the statement. Why removal of gonad is not considered a contraceptive option? So we have read about various contraceptive methods, also known as birth control methods. So is removal of gonad a contraceptive option? Okay. Now, what are gonads first of all? So gonads, they are the primary sex organs. This reproductive system of males and females, they consist of primary sex organs, accessory ducts, and accessory glands. Okay. Testes is a primary sex organ in males. Ovaries are primary sex organs in the females. So what these gonad do? They produce the gametes. They also produce and secrete the hormones. So obviously, if the gonads are removed, then the person will be infertile. The person won't be able to produce the children's. Okay, but can it be considered as a contraceptive option? This is the question. You can get the answer of this question from the NCERT section 3.2. Okay, or for the more information, you can read the section NCERT section 3.2. So, what will be the answer to this question? So think and answer this question. Okay. Then we'll have a look at the answer of this question. So let's have a look at the answer for this question now. A removal of gonads cannot be considered as a contraceptive option. Okay. So what are the reasons for that? Now, first is that if you remove the gonad, then it will be permanent and irreversible procedure. So the person will be infertile forever. Person won't be producing gametes. Hormones will also be not produced. So it will be an irreversible procedure. So once removed, the gonads cannot be replaced. You cannot replace the gonads by other things. Okay, you cannot continuously inject hormones in the body, because what these gonad do, okay, what is the function of say testes? So testes, they produce the sperms, which are the male gametes, and then they also produce the hormones, male hormones known as androgens. Example is testosterone, that is a male hormone. Testosterone is involved in spermatogenesis, sperm formation, and testosterone is also involved in the development of secondary sexual characteristic as well. So if the gonads are removed, okay, you can see there will be lot of effects on the person's physiology also, morphology also. Okay. So again, if we remove the gonads, there'll be no future possibility of natural reproduction. Okay, I'm saying natural reproduction here. Clear? Because the gametes are not being produced. In the females, if you remove the primary sex organ, there'll be no egg formation, there'll be no hormones will not be released. What are female hormones? Estrogen and progesterone. And no secondary sexual characteristic will develop if the gonads are removed at an early stage. So there'll be no future possibility of natural reproduction. And there is no way to reverse it also. So it is an irreversible and a permanent procedure. Second one is stop hormone production. If the gonads are removed, hormones will not be produced. And as I've told you, these hormones are involved in a lot of physiological functions. They help in the development of secondary sexual characteristic also. Okay. So they require lifelong replacement therapy. So lifelong, the hormones have to be injected into the body. Yeah. So gonads, they produce essential hormones such as testosterone and estrogen. Testosterone in males and estrogen and progesterone in the females. Okay. So hormones are not being produced. So what will be required? Lifelong hormone replacement therapy is required. So after, you can say, a few weeks, okay, hormones have to be injected into the body so that the body functions normally and there is development of the secondary sexual characteristic as well. Now this also disrupts the natural endocrine system function. So these primary sex organs, these gonads, they also act as an endocrine gland, and endocrine gland, they secrete hormones. So obviously if the gonads are removed, this will disrupt the natural endocrine system function as well. Here now, let's move on to the third point. Third point is ethically questionable as a contraceptive method. So removal of gonad is not ethically right also. Okay. So it violates the medical ethics. Okay. This is against the ethics, removal of the gonads. It is too extreme procedure. Clear? And it conflicts with the human reproductive rights as well. So humans, they have a right for reproduction. So it violates that rule also. Next one, causes serious physical and mental health issues. Okay. So what physical issues? So hormones are not being released. So there can be a lot of changes in the body. Okay. There can be a lot of metabolic changes also in the body. The metabolism can also change. The physiology can also be changed. And there can be mental health issues as well. The person can undergo depression. The person can suffer from anxiety. Person can suffer from mood swings also. Because everything is, you can say, dependent on the hormones. Hormones are regulating everything. So gonads, they are releasing hormones. Okay. So mental health of the person can be affected. Now, fifth one is better and reversible alternative exist. So lot of other contraceptive methods are available. Okay. and that are considered better, and they are reversible also. So reversible means when the person stops using this contraceptive method or any contraceptive device, such as condoms or IUDs, then again the females can conceive and the couples they can have the children. So ideal contraceptive should be reversible. Okay, this is one of the criteria of you can say ideal contraceptive. They should be user friendly, they should be easily available, they should be effective, they should be reversible as well. But removal of gonad, this is not reversible, this is a permanent and irreversible procedure. Okay, so a lot of reversible methods are available like IUDs, which are intrauterine devices which are inserted into the uterus. IUDs are also of three types: non-hormonal IUDs, okay, then copper IUDs, okay, then hormonal IUDs, then oral pills are available, implants are available, okay, condoms are available, which are barrier methods. Okay, clear? So better reversible alternatives are also available. And these are less invasive procedures also. And no, you can say less medical assistant is required. In removal of gonads, you can say a surgery is required, but if you use the contraceptive methods like barrier methods, okay, or injectables, or oral pills, so here no invasive procedures are required and less medical assistance is required. Clear? So these were the reasons why removal of gonads cannot be considered as a contraceptive option. Now, next one, amniocentesis for sex determination is banned in our country. Now, is this ban necessary? You can get the answer of this question from the NCERT section 3.3. So, amniocentesis is the technique, okay, which is used for sex determination. Clear? So, amniocentesis is used for prenatal sex determination. So, it has now been banned in our country. So, the question is this ban necessary? Okay, so for more information, you can read the NCERT section 3.3. Okay. So, what will be the answer to this question? So, now let's have a look at the answer to this question. So, amniocentesis, this is a prenatal diagnostic procedure. Okay. By amniocentesis, prenatal sex determination can be done. So, the gender or the sex of the fetus can be determined by amniocentesis. Amniocentesis can also be used for the detection of genetic disorders. Okay. So, what is done in amniocentesis? In amniocentesis, the amniotic fluid, which is present in the amniotic sac, this is taken out using a needle. Okay. And this amniotic fluid is analyzed. And this amniotic fluid consists of the fetal cells. These fetal cells can be analyzed for any chromosomal aberrations. Okay. And this can also be analyzed to determine the sex of the fetus as well. Clear? Okay. So now amniocentesis is being misused to determine the gender of the fetus. And if the couples they come to know that the fetus will develop into girl child, they will abort that child, and this is known as female feticide. So cases of female feticide, they are increasing. Okay. So if the female feticide cases are increasing, this can also disrupt the sex ratio in the society. That's why amniocentesis has been banned now, because it's being misused. Now, this amniocentesis Has an advantage also because it can be used to detect genetic disorders. And this amniocentesis usually performed between weeks 15 to 20 of the pregnancy. Clear? So procedure I've already told you. First of all, the ultrasound is done. Okay. Ultrasound is done to confirm the fetal position, and then the placenta is located. And then with the help of the needle, the amniotic fluid is taken out. So needle is inserted through the abdomen. Show you the image. Okay, this we have already discussed. So this is image of amniocentesis. Here you can see with the help of this needle is inserted into the abdomen. Okay. And then it crosses the uterine wall and it enters into the amniotic sac. This is amniotic sac. Amniotic sac, it surrounds the fetus. It protects the fetus. Okay. Clear? This amniotic sac consists of amniotic fluid. This amniotic fluid is taken out using this needle. And this is taken in this test tube. And then this amniotic fluid is analyzed. So this procedure is very fast. It typically takes 2 to 5 minutes to collect the sample, and around 20 to 30 ml of the amniotic fluid is withdrawn. Okay, then this amniotic fluid can be tested for any chromosomal abnormalities. So it can be used to detect genetic disorders like Turner syndrome, Klinefelter syndrome. Okay, sickle cell anemia. Clear? Okay, so in which cases amniocentesis is done? So amniocentesis is usually done when during the previous pregnancy there was a defect in the child. Okay, or when there is a chance of the fetus or of the newborn of the child, you can say, of getting a genetic disorder. So if the parents they know about their inheritance, that their baby can inherit a genetic disorder, in that case is also amniocentesis is allowed. Okay, this is clear. So in this image I have shown you the amniocentesis procedure. Now it has been banned because it was used for the sex determination of the child. Okay, so there are a lot of acts also like MTP Act, Medical Termination of Pregnancy Act. So this act also, you can say, prevent the misuse of these abortions that are being done. Still, there are a lot of female feticides that are happening. Now, suggest some methods to assist infertile couples to have children. Okay. So first of all, you should know what is infertility, and then how you can treat infertility. So basically, they are asking in this question, how can infertility be treated? Okay, so there are a lot of methods to treat infertility. Okay, we have already discussed in the theory what are the methods for that. So in this, you will list the assistive reproductive technology. Clear? So for more information, you can read the NCERT section 3.5. So what will be the answer to this question? So let's have a look at the answer to this question now. So here you can see, this is very important here, this figure, this flow chart. This is regarding the assistive reproductive technology, also abbreviated as ART, art. So here you can see this is further divided into two categories, the zygote and gamete. So in this category zygote, the zygote is being formed artificially outside the body, and then this zygote is being transferred into the fallopian tube or into the uterus. In the gamete, this category, within this gamete, there are three techniques, and in all of these techniques, gametes are involved. Clear? So first, let's talk about the zygote. So, zygote is formed after the fertilization. Means it is formed after the fusion of the male and the female gamete. Okay, it is a diploid structure. It is a unicellular diploid structure. So half of the chromosome it will get from the mother, half the chromosome it will get from the father. Okay. Now this zygote can be formed in natural conditions within the body, which is known as in vivo fertilization. So in vivo means in natural conditions. So in humans, the fertilization occurs internally. There is internal fertilization in case of humans. And the fertilization occurs in the ampulla region of the fallopian tube. Now, what is done here? These similar conditions are provided in the lab. Okay. So these conditions which are present inside the body, they are simulated in the lab conditions. Okay. So this is known as IVF, in vitro fertilization. You can see here, this IVF, in vitro fertilization. In vitro means in the artificial conditions. Fertilization means the fusion of the male and the female gametes. So here the fertilization is happening, okay, in artificial conditions. Here similar conditions are provided in the lab. Clear? So the egg is taken from the female and the sperm is collected from the male, and then they are fused together in the lab. Okay, this is being done artificially, and after the fusion, what will be produced? Zygote. So zygote is also produced here in the. It is being produced outside the body, in a culture plate or in a test tube. That's why this is also known as test tube baby program. Now the zygote is formed. Zygote will further divide to form the embryo. Clear? So IVF is followed by embryo transfer. Or in simple words, you can say after IVF, embryo transfer is done. Now this embryo can be transferred into the fallopian tube. Okay, or it can be transferred into the uterus. Yeah, so here you can see after IVF, embryo is transferred. Embryo can be transferred by two methods: ZIFT, which is zygote intrafallopian transfer, and IUT, which is intrauterine transfer. Okay. Now, what happens in ZIFT? Here, the embryo, which is up to 8 blastomeres, this is transferred into the fallopian tube. Okay. So, what happens in the natural conditions? Fertilization occurs in the ampulla region of the fallopian tube. So, after the fertilization, zygote will be formed in the fallopian tube. And then this zygote will start dividing as it moves towards the uterus. Okay, so similarly, what is happening here? We have implanted the embryo with up to 8 blastomeres in the fallopian tube. And then the normal process will take place. This embryo will start dividing. It will form the morula. It will form the blastocyst. This blastocyst will implant in the endometrium of the uterus. Then the fetus will develop normally in the natural conditions. So this is one procedure. Next one is intrauterine transfer. Here, when the embryo reaches the uterus, so it has divided further in the natural conditions. So in the uterus, the embryo with more than 8 blastomeres, embryo consisting of more than 8 blastomeres, this is transferred into the uterus. And then again, the embryo will divide, it will form blastocyst, and this blastocyst will attach to the endometrium of the uterus, and this process is known as implantation. So after the implanting the embryo in the fallopian tube or uterus, the embryo will divide in the natural conditions. Okay, so this was about the zygote. Then let's come to the gamete. Now here in the gametes are involved. First technique is GIFT, gamete intrafallopian transfer. Okay, so as the name suggests, it is the transfer of gametes into the fallopian tube. Okay, so again, what happens in the natural conditions? The egg and the sperm, they meet in the ampulla region of the fallopian tube. So ovaries, they release the egg, and the egg is captured by the fimbriae, which are present on the infundibulum, which is one of the part of the fallopian tube. Then the egg, it travels, it reaches the ampullary region. Then the sperm, they are, you can say, sperms are released in the vagina, then they enter into cervix and then into uterus, and from the uterus they swim and they reach the ampulla region of the fallopian tube. So what here is done artificially, the gametes, they are transferred into the fallopian tube. Okay, so sperm and egg both are gametes. That's why this is known as gamete intrafallopian transfer. Then after transfer of gametes, fertilization can occur, and then the normal process will occur. After fertilization, zygote will be formed, then embryo will be formed. Then, okay, so normal development takes place after that. So GIFT is done in certain condition. What is that condition? When the female is not able to produce the eggs, then the gametes are transferred, especially the ova. The egg is transferred from the donor female to the recipient female. The egg is transferred from the donor female to the fallopian tube of the recipient, because the recipient is not able to produce gametes, not able to produce the egg, but she can provide environment for fertilization. Okay, so sometimes due to certain diseases or due to PCOS also, or PCOD also, the females are not able to produce gametes. Okay, females are not able to produce the egg. So in this case, GIFT is done. Next one is intrauterine insemination. This is also known as artificial insemination. So what is done here? Usually this is done when the males are not able to inseminate the females. Okay, so question can come from here. When is artificial insemination done? When is GIFT done? So artificial insemination is also known as intrauterine insemination. Okay, here the sperms or the semen, this is transferred into the vagina or into the uterus of the female. If they are transferred into the uterus, then it is known as intrauterine insemination. Okay, then the entire process will occur naturally. The sperms, they will, you can say, swim, and then they will reach the ampulla region of the fallopian tube, and if the egg is present there, then fertilization will occur and the female will conceive. Okay, so this is done. Artificial insemination is done when the males are not able to inseminate the female or when the sperm count is low. Now, next procedure is ICSI, intracytoplasmic sperm injection. So what is done here? Here the sperms, they are directly transferred into the cytoplasm of the female, of the egg, you can say, the female gamete. Sperms are directly injected into the cytoplasm of the egg, bypassing the acrosomal reaction. So this acrosomal reaction, this helps in the penetration of the egg, or you can say this helps in the fertilization also. So when we studied about the structure of the sperm, so the head of the sperm, okay, on the anterior region of the head, okay, what is present? Acrosome is present. This acrosome consists of enzymes like hyaluronidase and acrosin. These enzymes help in the breakdown of the layers of the egg. Okay, so it helps in the penetration of the sperm into the egg. So here the acrosome reaction is bypassed and the sperm is directly injected into the cytoplasm of the sperm, of the egg. Okay. And once the sperm enters into the cytoplasm of the egg, then the nucleus of the sperm and egg can fuse with each other and zygote will be formed after the fusion of the nucleus of the sperm and the egg. So ICSI is also done in cases where there is low sperm count. Okay. So these were the techniques. Now let's discuss this technique as well. So these are assistive reproductive technologies. Okay. This all we have discussed. These are assistive reproductive technologies, abbreviated as ART, and they help infertile couples bear the childrens. Okay, what are the types of assisted reproductive technology? The first is IVF-ET, means in vitro fertilization embryo transfer. Okay, by in vitro fertilization, the zygote, or you can say the embryo, is formed and then the embryo is transferred. That's why it is written here IVF, embryo transfer. Okay, so within this, how the embryo is transferred? Embryo can be transferred into the uterus, which is known as intrauterine transfer. So embryo with more than 8 blastomeres, these are transferred into the uterus. This is known as intrauterine transfer. And then we have ZIFT, zygote intrafallopian transfer, where the embryo with up to 8 blastomeres, these are transferred into the fallopian tube. Now, what are blastomeres? So what happens when the zygote is formed? The zygote undergoes repeated meiotic divisions, which is known as cleavage. And the daughter cells are formed after mitosis. And these daughter cells, they are known as the blastomeres. Okay. So these were the techniques of embryo transfer. But the success rate, you can say this is less than 20%. Clear? And multiple rounds are required. And precision handling is required. So you can see for the transfer of zygote into fallopian tube, such precision is required. Transfer of embryo into the uterus, so much precision is required. A medical assistant is required. These procedures are done by professionals, medical professionals. And the success rate is very less. That's why these techniques are very expensive also. Expensive instrumentation is also required. So because of all of these factors, a lot of people, they can't afford these techniques. And these techniques are not well adopted also in India due to many reasons. Okay, some people, they don't think this ethically right because this is unnatural. Some have their different religious belief. Obviously, it is very expensive. Success rate is very less. And these facilities are not available. You can say these centers, infertility centers, they are not available everywhere in all the locations. So people don't have access to these infertility centers. Okay, they don't have any proper guidance to which method they should follow. So you can see here, this is the process showing you in vitro fertilization. So what is done in vitro fertilization? First of all, first step is ovarian stimulation. These are ovaries and these are the fallopian tubes coming from the ovaries. So there are two ovaries, so there will be two fallopian tubes. This is the uterus. Now what is done in ovaries are stimulated to release the egg. This egg is collected. Then sperms are collected from the husband or the male donor. Then insemination is done. Okay, insemination means what is happening here? The sperms come in contact with the egg. This is done artificially in the lab, in the artificial conditions. Or instead of insemination, ICSI can also be done here. In ICSI, we have discussed what is happening. These sperms, they are transferred directly into the cytoplasm of the egg. Sperms will be directly transferred into cytoplasm of the egg. So these things are being done, these procedures are being followed for fertilization. Okay, for fertilizing the egg. Eggs can be fertilized by conventional insemination or they can be fertilized using ICSI. After the fertilization, zygote will be formed. Zygote will develop into embryo, and then the embryo is transferred into the uterus or into the fallopian tube. Okay, so this is IVF embryo transfer. Next is IVF surrogacy. So what happens here? Embryo is formed and then it is transferred to the surrogate mother. So embryo, it is produced. Okay, it is formed in the artificial conditions, and then the embryo is transferred to the surrogate mother. Okay, why it is being transferred into the surrogate mother? Because the natural mother, she is not able to conceive. There's some problem in the implantation. There is some problem in the endometrium. Okay, so that's why the embryo which is formed, that is transferred into surrogate mother. So this surrogate mother can provide the environment for the development of the fetus. Again, the success rate is 65% here. Okay, so more than IVF, these embryo transfer that we have discussed earlier. Now, next one, gamete intrafallopian transfer. Here, the gametes are transferred into the fallopian tube. So, here the unfertilized egg from the females and the sperm from the male, they can be transferred into the fallopian tube. Okay, of another female. So, why this GIFT is done, gamete intrafallopian transfer? These are done in cases where the female is not able to produce the eggs. So, eggs are taken from other female and these are transferred to the recipient female's fallopian tube. And then the fertilization will occur and the natural process will occur after that. Success rate is 30%. Here again, very low success rate. Next is intracytoplasmic sperm injection, ICSI. So what happens here? The sperms are directly injected into the ovum. So this is done in the case where the sperm count is low. Okay, ICSI is also done after IVF. After IVF, fertilization can be done through ICSI or through conventional insemination. Also, success rate is 60 to 70%. Okay. Then artificial insemination, abbreviated as AI. This is also sometimes known as intrauterine insemination. So here the semen is introduced into the uterus or into the vagina. Okay, and after the introduction of the semen, what is done? Then the natural process will occur. The sperms, they can swim and then they can travel. They will reach the ampulla region of the fallopian tube. And if the egg is present, then fertilization will occur. So these, you can say these techniques, they are done. Okay. And everything is being monitored. The menstrual cycle of the female is also monitored when the ovulation will occur. So accordingly, the insemination is done. Okay, because egg should be present at that time. That's why the success rate of these techniques are very less. Okay, artificial insemination is done in the cases where the males are not able to inseminate the female or where the sperm count is low. Success rate is again 20 to 40%. Okay, so these were the assistive reproductive technology techniques. Now, which method to follow? How will you know which method to follow? So you can consult the fertility specialist for that. They can guide you. You can understand the success rate of each of these techniques. Yeah, then you can evaluate the financial implications, because these techniques, they are very expensive. They need multiple rounds. Okay. So you should evaluate the financial implication also, how expensive the procedure can be. You can discuss the options with your partners also. Okay, and the best approach means which technique or which approach to follow depends upon the age of the male and the female, the age of the partners. Okay, what is the cause of fertility, the medical history of that person, then personal preferences, which technique the couples or the female want to follow, then the financial resources, how much money they want to invest in these techniques, and then there are a lot of religious and cultural beliefs also. Okay, so all of these things are taken into consideration when you are selecting any technique as a treatment for infertility. Okay, this is clear. Now let's move on. Now, next question: what are the measures one has to take to prevent from contracting STDs? Okay, what measures should be taken to prevent the spread of the sexually transmitted diseases? So, sexually transmitted diseases, they can spread during, or they are spread through sexual, they are spread during the sexual intercourse. They are spread by the body fluids, semen, and the vaginal secretion. So you have to answer here, what steps can be taken to prevent the spread of STDs, or how can you prevent contracting STDs? So for more information, you can read the section NCERT section 3.4. So what will be the answer to this question? Let's have a look at the answer now. Measures one has to take to prevent from contracting STDs are: the first method, blood transfusion from an infected person or drug abuser must be avoided. So these STDs, they can be transferred through blood also. Okay, so these, some of the STDs like hepatitis B and HIV, they are transmitted, okay, through sexual intercourse also, and they can be transmitted through blood also. So blood transfusion from an infected person to drug abuse or drug abuser must be avoided. Avoid sharing the needles. Okay, sometimes these diseases can be transmitted by using contaminated surgical instruments also. Okay, so through blood transfusion, the STDs can also transmit from the infected person to healthy person, but the chances are very rare. So there is only 2% chance of, you can say, transferring of the STDs through blood transfusion. Next is sharing surgical instrument and injection needles. So this must be totally avoided. So contaminated surgical instrument and injection needles, use of these, you can say, or reuse of these needles should be totally avoided. Next is having sexual intercourse with an unknown or multiple partners. This must also be avoided. Okay. So this spread of the STDs, this can also be controlled by, you can say, you by this be by adopting a behavioral approach. Because of the behavior, because of the lifestyle of that person, these STDs can also spread. Okay. So avoid having sexual intercourse with unknown or multiple partners. Then always use precautions such as condoms during the intercourse. So these condoms, they are contraceptive methods. They help in the family planning. They help keep space between the children. These condoms also help to prevent the transmit of the sexually transmitted diseases, because these condoms, they cover the reproductive organs. Male condoms, they cover the, you can say, penis, and the female condom, it covers the cervix and the vagina. So the semen, it cannot enter into the female genital tract, and the vaginal secretions cannot enter into the male genital area. So, as you know, these STD, they are spread through body fluids, as there is no transfer of the body fluids between male and the female by using condoms, which is a kind of barrier method. So, the spread of the STDs can be prevented. Now, in case of any doubt, early detection and medical assistance must be taken from a qualified doctor. So, if the person have a doubt that the person have some symptoms of STDs, then the person should take medical assistance. The person should take proper treatment and complete treatment from a qualified doctor. And regular screening and early detection of STDs, this is very important, because if the STDs, they are detected early, some of the STDs, if they are detected early, they can be completely cured, especially the bacterial diseases. If they are detected early, they can be completely cured. Although there is no complete cure for viral STDs, but for bacterial STDs, there is a complete cure. Cure can be done using antibiotics. Okay, so this will early detection will also help in the preventing the spread of the STDs as well. So here you can see how these STDs can spread. It can spread by unprotected intercourse, so condoms can be used. It can be spread through needle reuse also. So more than 90%, in more than 98% cases, STD are spread through during unprotected intercourse or by using needle, reusing the needle, and less than 2%, okay, by blood transfusion and during the pregnancy. The STDs can also spread during the pregnancy from the mother to the fetus. Okay, so these, you can say pathogens, they can cross the placenta and they can reach the fetus. These STDs can also spread during the childbirth, and some of the STDs, they can also spread during the breastfeeding as well. Clear? So here, let's discuss this question, state true or false with explanation. Okay, so here the statements are given to you. You have to tell whether which statement is true and which statement is false. Okay, the first statement is abortion could happen spontaneously too. Is this statement true or false? Next statement is infertility is defined as the inability to produce a viable offerings and is always due to abnormalities or defect in the female partner. Is this statement true or false? Statement C is complete lactation could help as a natural method for contraception. So here they are talking about the lactational amenorrhea, which means during intense lactation, there is no menstruation, there is no ovulation. Okay. Is it a natural method of contraception? They are asking. Then option number D is creating awareness about sex-related aspect is an effective method to improve reproductive health of the people. Is this statement true or false? So let's have a look at the answer to this question now. Okay, so let's have a look at the answer. So statement A is true. Abortion could happen spontaneously. So these are known as spontaneous abortions. And these are different from induced abortions, which are also known as MTPs. And the spontaneous abortions, they are known as miscarriage. Clear? So that's why statement A is this is true. We are talking about spontaneous abortion here. Okay. What are the common causes of spontaneous abortion? So there can be some hormonal issues and some medical conditions which can lead to spontaneous abortions. Now, second statement, option number B. This statement B is false because this is not the correct definition of infertility. Infertility is defined as the inability to produce viable offerings. Okay. Even after having unprotected intercourse. Okay. So infertility is defined as the inability to produce viable offerings and can be due to abnormalities in either the male or the female partner. So here in the statement it was written abnormality, so defect in the female partner only. But this is incorrect because it can be due to abnormalities in either male or in the female. So sometimes the male, they are not producing viable gametes. They are not producing adequate amount of sperm, so sperm count is low. And sometimes the females, in the females, the fallopian tube is blocked. In the females are not able to produce the eggs. Okay. Clear. So both male and female partners can be responsible equally for the infertility. Next statement, complete lactation could help as a natural method of contraception. This statement is true. So here they are talking about lactational amenorrhea. So what happens during intense lactation when the mother is producing milk? Then what happens? There is no menstrual cycle. There is no menstrual cycle means there is no ovulation. There is no egg production. If there is no egg production, then obviously, even if the sperm is there in the fallopian tube, there will be no fertilization. So this is the natural method of contraception because no medicines and no hormones are being used here. So there will be no side effects of these natural methods of contraception, but they are quite risky. And lactation amenorrhea, this is only, you can say, works till 6 months of the after the childbirth. So the female will not conceive after 6 months, till 6 months after the childbirth. So chances of failure of the natural methods of contraception, these are very less. Now, option the statement D, creating awareness about sex-related aspects is an effective method to improve reproductive health of the people. So this statement is true. So yes, awareness about sex-related aspects can improve reproductive health of the society. Here, so information should be given regarding the use of contraceptives, regarding safe sexual practices. Awareness should be spread regarding the sexual abuse, such as rapes and crimes. Clear? So this will all improve the reproductive health of the society. Clear? Now let's move on to the next question. Correct the following statements. Okay. These statements are given to you 4 statements. You have to correct this following statement. First statement is surgical methods of contraception prevent the gamete formation. Okay. So this statement is true or false. You have to correct this statement. Statement B, all sexually transmitted diseases are completely curable. So are all STDs completely curable? Then statement C is oral pills are very popular contraceptive among the rural women, they are saying. And statement D, in ET techniques mean in the embryo transfer techniques. Embryo are always transferred into the uterus. So is this statement correct or incorrect? So what will be the answer to this question now? So let's have a look at the answer. Now, statement A, surgical method of contraception prevent gamete formation. This statement is not correct because surgical methods, which are permanent methods, they're also known as terminal methods, sterilization. These are contraceptive methods to prevent the gamete transport. So they block the gamete transport because in surgical methods, the vas deferens and the fallopian tubes in the females, vas deferens in the males and fallopian tubes in the females, they are cut and tied. So this blocks the gamete transport during the act of the intercourse. Okay. Now, next statement, all sexually transmitted diseases are completely curable. This statement is also incorrect. So what will be the correct statement here? Some of the STDs can be cured if detected early and treated properly. But other diseases, or you can say the viral STDs, there is no complete cure for viral STDs such as herpes, hepatitis B, and AIDS. And AIDS is most fatal, it is most dangerous because there is no cure for AIDS. It is completely incurable. Rest of the diseases which are caused by bacteria like gonorrhea, syphilis, and trichomoniasis, which is caused by a protozoan, these diseases, if they are detected early, they can be completely cured through antibiotics. Now, for the viral STDs, the symptoms can be managed. Okay, but there is no cure, but only the symptoms can be managed using the medications. Next one is oral pills. They are very popular contraceptive among the rural women. So this statement is also not correct because oral pills are very popular contraceptive among the urban women. Okay, urban women, they are working, they are adopting single child norm. They only want one child. And oral pills are very popular among them because these oral pills, they have minimum side effects. They are easy to use also. And now, like Saheli has been developed by CDRL. Like now, this Saheli, this is non-steroidal, and this is once in a week pill, and it has very less side effects because it is non-steroidal. Then, last statement is in embryo transfer techniques, embryos are always transferred into the uterus. So this statement is also not correct because embryos, okay, they can be transferred into the uterus also, and the embryos can be transferred into the fallopian tube also. So actually the correct statement will be in embryo transfer technique, the embryos up to 8 blastomeres, these are transferred into the fallopian tube, and the embryos with more than 8 blastomeres, these are transferred into the uterus. Okay, this is clear. So we talked about two embryo transfer techniques, ZIFT and IUT. ZIFT is zygote intrafallopian transfer, where the you can say the early embryo consisting of 8 blastomeres are transferred into the fallopian tube, and the embryos with more than 8 blastomeres, these are transferred into the uterus of the fallopian tube. Okay, so with this, we have discussed all the questions of this chapter, reproductive health. Here, so basically, you can see the birth control measures, these are very important. Okay, assistive reproductive technologies, these are very important. Here, to focus on these topics, contraceptives and the assistive reproductive technologies. Okay, so these topics are very important for your NEET exam as well. Clear? So this was the end of this session. I hope this session was quite knowledgeable for you. We'll meet you in the next session. Thank you very much for listening.